Thank you very much. Hopefully, I can give you all a bit of an overview about artificial intelligence and how it can be useful in helping our patients avoid development of complications, or if they have complications, how we can better manage them on a bigger scale. A little bit about me, as we've mentioned, I work in Sydney, Australia. I've had a lot of experience in a variety of different endocrine disorders, but I do have a specific interest in health technology and artificial intelligence. Just as an overview in regards to the global burden of diabetes, it's a rising prevalence with over 500 million adults at the age of 20 to 79 living with diabetes as of 2021, and that's projected to rise to 643 million by 2030 and 783 million by 2025. And in this context, we realize that the complication rates will also increase, and therefore having larger scale applicable services for our patients is imperative. It is the leading cause of death, and it's responsible for 6.7 million deaths annually, making it one of the top 10 causes of death worldwide. And 1 in 10 adults in the world has diabetes, with that number being a lot higher in India. How can we utilize artificial intelligence? It can be applied in many different aspects. It can be for predictive analysis, automation of tasks that we normally do, or for a decision support system. And why endocrinology and diabetes? So we know diabetes is a chronic disease, and having artificial intelligence in this context allows us continuous monitoring and personalized care. It's a data-heavy management where we look at values in the labs, and we can use these in an automated manner to try and assist our patients better, and we can have enhanced patient engagement as a consequence. First, I'll start off by talking about general clinical artificial intelligence, including predictive workflows, automated workflows, decision support systems, as well as how we can use it in diagnostics, and eventually I'll go through ethical considerations as well. It is a very short amount of time in 20 minutes to try and talk about all of this, so if I do run out of time, I have slides I'm happy to share if we need later on. In regards to an example of how we can utilize AI in predictive analytics, so if we were talking about sepsis detection in hospitals, we know that it's a significant issue and a burden of disease for patients, especially with diabetes. So in AI analytics, we can use algorithms to analyze large data sets from electronic health records to see which patients may be at higher risk of developing sepsis. And these models will then be able to allow doctors to target treatment earlier. In hospital management, it's a reduced mortality as a consequence of this, and also reduction in ICU admissions or length of stay, which will then have financial benefits for the hospital services as well as the patient. It has improved workflow for clinicians. If you, for example, have an extremely busy workforce, you're understaffed, and you've got patients that are quite unwell, if you have now a tool that can automate identification of patients that may need intervention, that makes your work a lot easier, and it also helps with quality of care. In regards to relevance with diabetes patients, as I mentioned, they're very vulnerable to infections and sepsis, and therefore having such a system in place can be extremely positive for us. Another example would be triaging and bed allocations. A lot of hospitals, especially in Australia, there's emergency wait times of over 12-15 hours just for a patient to be seen by a doctor or a nurse. If we were able to have a system in place that can triage more urgent cases versus less urgent cases, that will allow us to be able to allocate beds faster, intervene quicker, and therefore prevent complications earlier. And this in endocrine in particular is relevant for diabetic ketoacidosis and adrenal crises. So we can utilize AI to triage patients even from their home. And there are systems that I'm implementing in Australia where we're able to have patients input some data on the way to the hospital or even before they've come to hospital, which allows doctors in hospital to allocate staff earlier to these patients, as opposed to them coming to hospital, waiting to be seen by a doctor, and then there's a delay there. So it has significant power in improving quality of care. Now, in terms of automated workflow in hospital itself as well, we can ensure faster and more efficient care. So if a patient has DKA from home, they've mentioned their sugars are high, their ketones are high, they're drowsy, they've had a seizure, whatever it may be. You've got everything ready to go when the patient's in hospital. You can put the insulin infusion up, you can replace the potassium, you can get the ICU bed ready as soon as they're there, bloods can be collected, and everything is much more efficient. So, to summarize that, faster care delivery, so reduced time to treatment, improved resource management because you know what's needed where. You've got enhanced patient outcomes because of all of these earlier interventions, and a reduced clinical burden because we don't have to go through a repeated process of full assessment start to finish. Patients have already put in some of that data themselves pre-hospital. So there are decision support systems that are in their early iterations, but only getting better and better as each week passes. For example, systems like the IBM Watson and Google DeepMind, they empower us to have real-time, data-driven patient outcomes in endocrine and beyond. If we talk about diagnostics, and in particular with radiology, there are a lot of systems available now that use artificial intelligence overlays. And so, for example, for us, if we had a patient which had a thyroid nodule or a pituitary tumor or osteoporosis, there are algorithms that are being trained and refined as we speak, which allow high accuracy reporting on the spot. So instead of having a scan of the pituitary done, waiting for a radiologist to report it, which may have a 6-hour, 12-hour, 24-hour delay, these algorithms are able to give you 70, 80, 90% accuracy of what the things that might be wrong with this patient are live. So as soon as the scan's done, the images are analyzed through the model, and they've got a summary of what might be going on, and so therefore it allows us to make decisions a lot quicker. An example would be if someone's had a thyroid ultrasound and it looks suspicious, TIRADS 4, TIRADS 5, these AI algorithms that are being developed can immediately give you an answer about what they think is going on, and you can do a biopsy then and there as opposed to waiting for someone to analyze it. There are ethical considerations when it comes to artificial intelligence, and this is the main limiting factor when it comes to implementing this broad scale at this stage, because the technology is advancing extremely quickly, but the government regulations are lagging behind quite significantly as well. So, number one, there is the possibility of bias. Now, these systems and the decisions that the AI provides us are based on trained data sets. However, sometimes there can be inherited bias in the data. For example, if we had a model that was developed in India, and I want to apply this information to Australia, the genetic cohort, the population might be very different, because in Australia there might be more Caucasian patients, whereas here there's more Indian patients. So there's some small nuances there that we do need to improve on. Secondarily, there's a lack of transparency at this stage because some AI algorithms work as black boxes. So we don't know how or why the information is being provided because of their deep neural networks. And that's something that we need to clarify as well. And thirdly, there's a fear that AI is going to take over our jobs. Now, I think that's unlikely. I think what will happen in the next couple of years is we're going to start coexisting with AI a lot stronger. We're going to have AI provide us improvement in efficiency, and we're going to be able to depend on AI more reliably and accurately as well. Now, in specific discussion about endocrinology and diabetes-related artificial intelligence, we talk about glucose monitoring, which has been well established, complication prediction, personalized therapy, population health management, as well as the use of wearables and IoT integration, which is Internet of Things. We know that there's a lot of insulin pumps that are very well established that use AI, for example, Medtronic's 780G. And this basically has real-time glucose updates with CGM, and it can predict in advance whether a patient is going to have hypoglycemia or hyperglycemia, and it can adjust how much insulin administration occurs in that context. And you know, there's 24/7 data being sent real-time to your smartphone via the apps, and the algorithms can predict what's going on and adjust according to that. So this is a very simple closed-loop system which allows us to be able to make AI decision-making processes. In the near future, there'll probably be even more input from these pumps where carbohydrate intake may not even need to be entered because the algorithms will be able to detect, based on the rates of spike and the type of meal that you've had, what will happen as a historical data set based on the model as well. Now, what it does is it enhances patient outcomes, it reduces the burden for the patient, and it empowers the patient to take control of their own health. So the glucose monitoring by AI will help us improve glycemic control and reduce complications because your time in range improves, your hypoglycemia reduces, and as a consequence of that, there's also reduced workflow, reduced admissions for hospital, and reduced input between clinicians and patients about what to do and when to do things. And ultimately, that allows patients to enjoy and have a better quality of life. In regards to complications, there are now hundreds of companies out there that are doing AI-based retinopathy screening. And so essentially what happens is there are large data sets, including in India, which was one of the earliest nations to incorporate this, where these scans are uploaded to the cloud with the AI model. It analyzes and detects if there's mild, moderate, or severe diabetic retinopathy, and immediately sends a report back to you as to what you would ideally need to intervene with. So it has significant benefits for us, especially when there's distance-based issues. So for example, if someone's in regional India and they don't have access to a major hospital or an ophthalmologist, for example, you can train nursing staff or allied health staff with these mobile portable cameras. They can take the image, it uploads to a cloud, and immediately, real time, you can get information about the severity of their disease to enable them then to seek urgent assistance from an ophthalmologist. In regards to nephropathy, similar things are being developed. So we know that the importance of urine albumin to creatinine ratio is profound. And these AI models with routine blood tests and urine samples can now predict if there is progression of diabetic nephropathy for us to be able to intervene earlier, either with addition of an ACE inhibitor or an ARB, an SGLT2 inhibitor, or even finerenone, for example. And it does predict whether there's any other complications that may need to be intervened earlier as well. In regards to some examples of retinal cameras, so there's IDXDR, there's other retinal cameras from Topcon Health, and also iArts, and there's another American company called AI, which is also very, very commonly utilized in Australia and the States. In regards to personalized therapy, there's a very significant shift towards machine learning for drug selection happening now as well. And certainly in Australia, we're trying to incorporate this in our public health system. So, for example, you're a junior doctor in hospital. It's your first day. You don't know what's going on. There's a lot of patients. And then the nurse calls you and says, hey, this patient has this medication. What do I do? And you've never heard that medication before. The option with AI here is that it can analyze based on what medications the patient is on in your electronic health system. It can analyze your kidney function, your cardiac status, etc., and then provide a suggestion based on all of those parameters whether the patient should be on certain medications or shouldn't be on certain medications in the context of their presentation. So if someone has come in with acute kidney injury, they've got an impending surgery, they've got cardiovascular disease, and they're essentially going to need to be fasted, these personalized therapies can then immediately analyze all of those things and say, withhold metformin, withhold SGLT2 inhibitor, utilize insulin in the short term because HbA1c is high, until post-procedure when they can start those medications again. So this is something that will help minimize complications in hospital and also prevent patients from having further issues. Now, benefits are profound when it comes to personalized therapy. It tailors individual patient needs, improves sugar control, reduces side effects, and also it improves cardiovascular risk complications, renal complications, and even with weight management, with the GLP-1 receptor agonists now at play, can also help from that perspective as well, given that BMI data is very readily captured in electronic health systems as well. So this is just a rough thing that I've made in regards to what you could consider a very simplistic form of a criteria. So if you've got a patient that has an elevated HbA1c, they can intensify therapy based on the algorithm. If they've got good control, then they may say continue your current therapy or de-escalate. If they've got cardiovascular disease, then the options to add on might be different. If they've got renal impairment, similarly, they might adjust doses of medication or types of medication. In regards to population health, this can be applied in general practice as well, not just in hospitals, because we will be able to collate data at large scales, depending on collaboration between hospitals and practices, and differentiate based on categories of low risk, moderate risk, or high risk. And based on these, we can then ascertain whether patients need earlier intervention, de-escalation of treatment, more diet intervention, more exercise intervention, or if they need psychological intervention, depending on compliance and things like that as well. So it has the scope to be quite holistically beneficial from a patient's perspective. Quick mention of wearables and IoT integration. As we get further along with technology, there's more applications being introduced, like smart insulin pens, which not only tell you how much insulin you last took, so that patients don't forget, but also have real-time feedback and reminders for patients about when their next dose might be due. A lot of times when patients have hypoglycemia and they're taking mixed insulin or rapid insulin, it's because they're taking the insulin too late and they're therefore having hypoglycemia 3-4 hours after their meal. These types of smart insulin pens can provide minimization of those types of complications. CGMs, as we all know, in India, Libre 1, but in the near future, Libre 2 and Libre 3 and 3 Plus will come out. And we've also got Medtronic continuous glucose monitors as well. And I've already talked about how they are very beneficial to minimize hypoglycemia. And IoT integration will be things like Alexa, Google Home, things like that. So you can essentially at home say, hey Google, I've taken 20 units of insulin at 8 a.m. Can you please remind me to take insulin at 8 p.m. before I have dinner? And then at 8 p.m. it'll automatically sync in, and it will even, in the near future, be able to link with your continuous glucose monitor and say, your insulin is due, your routine dose is 20 units, however, because your glucose is high, I would suggest taking 22, 24 units, for example. So it has a very significant real-world interactive benefit, and this is something called agentic AI, which is where it's not only about looking at a model and it gives you yes, no, do this, do that. It's actually conversational. And this is the next phase of artificial intelligence. So early iterations are where we're just having output, but soon we're going to have input and output simultaneously. So if you had, for example, pregnancy diabetes and the patient said, hello, I've had chole bhature and my sugar went up really high, despite insulin, what do? Then the machine algorithm will feed back to you saying, given that traditionally chole bhature has much higher carbohydrate quantity, it may be a better idea next time you have this food to take an extra 2 to 4 units depending on what your doses were, or increase by 10%, for example. So it's a very useful clinical application for patients as opposed to waiting for the next appointment, waiting for a doctor. And in hospital, it can also streamline a lot of the small menial tasks that junior doctors may need to do with adjusting insulin, rewriting prescriptions, etc., because it can all be automated with variable dosing. Practical implications. So I talk about all of these things, but how do we actually integrate them? First and foremost, you need those IoT devices to allow for patient monitoring and real-time data streams, so internet access, because it goes to a cloud server. In regards to cloud servers, there's no point having something that's 8 megabytes in size. You need something that can actually be scalable, because the more and more patients that get entered into these systems, the more and more scalability you will need, as well as backup and disaster recovery systems. Okay, I'll go through it quicker because I've got a lot of slides, but I'll cover some of these things. And the other thing is EMR integration, because there's no point having a cloud server that doesn't talk to the EMR. You need them to be interlinked, and that's something which will change in the near future, where ideally things are centralized through governments or through hospitals, where all practices around the hospital and the hospital itself have compatible synchronized systems where you can actually utilize data instead of having to go through different practice software. It's a collaboration between IT personnel, clinicians, and also administrators. And the combination of all of these three together is what will help improve clinical outcomes. So it's not about categorizing doctors as doctors, IT people as IT people. It's about using all of us and our knowledge in synchrony and harmony to help improve patient outcomes, minimize logistical problems, and overall minimize complications. Okay? I'll skip through all of these things briefly, but it's about impact versus effort. So you can have high impact and low effort, which is a quick win, and these are cases that can make a quick difference with relatively low resources. For example, hypoglycemia reduction using AI. high impact and high effort, which is where there can be a big long-term impact, but you need a lot of capital investment and a lot of resource, and that's where you're doing personalized treatment. Then you have low impact, low effort, which you don't want to do. Minimal effort, but minimal impact as well, just data collection in essence. And then you've got low impact with high effort, which you want to try and avoid entirely because you could probably spend your time doing other things more. And that would be things like administrative automation of mundane tasks. Now, regulatory stuff, I'll briefly mention. There's a whole bunch of different organizations that are relevant when it comes to AI in India and around the world. And it's about trying to work with those to improve quality of care for patients. From a budgeting perspective, there's a whole bunch of different things there, and I'll skip through this one, but essentially, for example, if you had invested $650,000 into an AI model, within 12 months, you'll have a return of investment and you'll break even, and then every year beyond that, you'll be able to actually save money compared to spending that type of investment in admin time, in hospitalizations, in complications management, because you're preventing all of those issues from happening. So from a cost to benefit ratio analysis, there have been studies done that prove it is extremely beneficial. Scalability, I've already talked about, so I'll skip through this. There are some apps available like the DreamMed Diabetes Advisor and the GlideTech management system, which you can personalize for patients. And custom model development, we can talk about outside afterwards in the interest of time. And I'll just finish off by saying that essentially it's about patient engagement. So we do all of these things not just for the hell of it. Technology is there to help us. It's to try and help improve patient quality of life, minimize complications. And so the primary thing is to improve patient engagement. No patient wants to sit in the waiting room for 5 hours. The first complication or complaint people have is, "Mujhe nahi baithna, I want to go quickly in, quickly out, go home." This allows us to do that. You can be sitting in the comfort of your home, communicating with an expert in your field with automated replies live, and that will help improve patient compliance to their therapy, minimize complications, give them empowerment about they can take charge of their own health, and therefore that is the primary aim that we wish for. Thank you very much.